Hi, Alvin DeLeon here, and you are watching episode 35 of the 3-Minute Health Tip. In this episode, I'm going to talk about hip pain. If you're watching this and you're dealing with your own hip pain, or perhaps you're a practitioner that treats people with hip pain, I just want to reiterate the fact that we're not talking about hip pain from a physical trauma. Perhaps, you're suffering from your hip pain because you hurt yourself playing soccer or hockey, or maybe you had a car accident or a fall at work or down the stairs in your home. That's a physical trauma causing your hip pain, which again, conventional therapies and treatments should be able to alleviate that and allow it to recover. I'm talking about unexplained hip pain, that you wake up one day and your hip is hurting, whether it's the front of the hip, the sides of the hip, the back of the hip, and you didn't do anything to cause that pain. We're looking at unexplained hip pain, again, from the perspective of looking at the person as a biological unit, that whatever is happening to the muscles of your hip is also affecting the brain, and that this entire biological program was initiated by some sort of unexpected conflict that you experienced in your life. One of the ways that we explain, or we help our patients overcome their unexplained hip pain, is by getting them to recognize and become aware of what was the conflict prior to that hip pain showing up that they perceived. And again, we have very many different conflict themes. Those of you that have been watching these previous videos, I've covered some of them. You can actually learn more about it on the learninggnm.com website, and you can look through the index to identify some of these conflict themes. But the conflict related to unexplained hip pain is what's known as self-devaluation regarding bearing responsibility. That means that when you have an unexpected event in your life that makes you feel like I'm no longer able to bear the weight of the responsibility, whether that's a responsibility regarding your family, your work situation, your relationships, your financial situation, the moment you're no longer able to endure the responsibility, it's too much to bear, it starts to develop into some sort of hip pain. We see this all the time where we have perfectly healthy athletic soccer players out of nowhere getting hip pain, and we start to identify that it has to do, in this one particular case, with a gentleman who was renovating his house, hired contractors to do the work, and it delayed it 6 months because he hired the wrong contractors. The house wasn't ready through the winter, which really affected his family, and has created a huge stress where he felt responsible for it. Or we get this a lot with women getting hip pain in the middle of a divorce or a separation, where they feel like the children are all their responsibility and they're not getting the help to bear that responsibility or to share that responsibility. So if you're dealing with hip pain, or you are a practitioner that sees people with these unexplained hip problems, one of the things that you want to ask yourself or ask your patient is, what was going on in your life prior to this hip pain showing up, where you felt that you could no longer bear that responsibility or endure the responsibility? It was too much to bear. And how can you change your perspective on it? How can you recognize that it's not all your responsibility, that there's actually people to share that responsibility with? Or you just look at the fact that I've done everything that I can and I don't need to be hard on myself, that in fact I can handle this, that I can bear this responsibility. And hopefully being able to help them to become aware of that conflict with the therapies and the modalities that you do can help alleviate those symptoms a lot quicker than without the awareness of that conflict. Go out and apply this information. I hope that health tip was valuable, and I want to thank you as always for your attention, and I'll see you at the next episode.